We're here at Dunn House at 90 Dunn Avenue.
Today we're outside of Dunn House in Parkdale.
We're outside Dunn House, which is a social medicine building here in Toronto.
When I first heard of Dunn House from Dr. Andrew Boozer, he said one statistic. He said 235 people in the city, some of the most challenging health circumstances, who are unhoused, take up 15,000 emergency room visits a year.
When you look across almost every jurisdiction, what we see for people who are chronically unhoused is they live half as long as the general public. You're seeing $30,000 a month or more for people in a hospital bed. You're seeing around $15,000 in the prison system, $7,000 to $6,000 in the shelter system per month, and less than $4,000 for supportive housing.
My name's Jason. So I was one of the first to move in. I spent 6 years homeless prior to this. 1 year alone, I spent around 131 days in the hospital. I basically had to fight for myself to survive every day for that time. So I think a lot of people have this view of homelessness as people that always didn't try and always didn't have a chance, and that's not the case. I had a successful job, and I was a family man, got university and college diplomas. There's a lot of people that are homeless in the street, have come upon hard times, and that's just something that they've been faced with. Even getting somebody's attention to really start the ball rolling on helping you is extremely difficult, extremely long. Navigate through the systems and the hurdles you're going to face is challenging.
Dunn House is special for many reasons. One being that it's in direct partnership with the hospital. So we're collaborating with the pharmacy, we're collaborating with Ontario Health at Home providers, and really trying to link our clients to getting care.
I'm incredibly inspired by Dunn House and seeing this combination of rapidly building housing for people who are homeless or at risk of homeless and giving them the opportunity to rebuild their lives. They've got to have health supports that are connected to their homes. It allows people to get better, to heal, put their lives back together, and saving taxpayers a lot of money and start contributing again to society rather than having to draw resources away. So the biggest opportunity here is that we have community partners who know how to build this, who know how to provide the health support, who know how to look after the people, the food, the cultural support that's needed. We have all that in our communities. What we need is the federal, provincial, and local governments to step up and work together to fund these programs and these homes, and to make sure that those community partners can do what they do best and take care of people.
Dunn House, which was in the platform, is a model that when you give people housing and wraparound services, it has transformative impacts, not just on their lives, but on so many other systems. This aligns with the Prime Minister's mission: lowering emergency room visits, lowering costs of policing and fire services, and giving wraparound services to people. And so you realize that we need to scale this.
Having this place has given me belief again. You know that you've got a team behind you, and everybody wants to see you successful. You really feel like you can actually, not only can you live, but it's a life worth living again. The wraparound supports and the way we're treated here and live day to day, I feel very strongly about what it's done for me, and it's given me a chance to give back. And I've been given a lot of things in recent times, and it's important to pass that along.
So my hope is that it's a real testament and a real opportunity for the federal government to scale something that has affected people at an individual level, and as more and more data is coming together around the significant impact on reducing system pressures in both healthcare, the justice system, the social system, that solutions like Dunn House can bring, and not only in Parkdale, but I mean the real hope and push for this from the beginning was for this to be a model for the country.